And the hospital guy said, just give her some glucose. She was pre-diabetic for a decade. Imagine if they would have given her glucose that day.
So if you look at a photograph of people on a beach in Blackpool in 1970, 80% of people that are obese are going to become type 2 diabetic. 23.4% of their population are type 2 diabetic. Since COVID, the population from 20 to 30 now is one of the highest growth in type 2 diabetes. It's a silent illness. There's no indicators until you get a symptom. I got an urge to go to the toilet and I actually wet myself. One lady in particular lost 4 stone in weight. She was a diabetic living on insulin. And do you know what age she was? 75. Can you change? Yes, you can.
Thanks for doing this, Phil.
You're welcome.
You really appreciate you coming down from Edinburgh to Manchester for this. I think you started at 4 a.m.
It was an early wake-up call this morning. Yeah. I was up with the birds.
Yeah, that's good. And it's always good to wake up early. I mean, I'm an early bird, but 4 o'clock is just pushing the envelope.
Well, for me too, but the coffee's a great thing.
Yeah,
especially when you're driving all that way.
I remember talking to you first, Phil, when we spoke about, how people don't understand the importance of getting themselves tested, first of all, and not knowing, they're diabetic, pre-diabetic. And I think this is a challenge we see in the Indian market. I'll start with my own example of, my experience with this, people not being aware of their health condition. Most people don't even go for a health checkup. While India is very big on healthcare and very big on, we have really good access, private access to hospitals, to laboratories, who can turn around quickly. But I just think people don't do it often enough. So, and I remember we spoke about this. So my experience here is very personal. So my mom is diabetic. But she didn't know that she was diabetic, and it happened by accident. When I say accident, literally fucking accident. It would have been a car crash, if she did not get to know at the right time. So my mom was traveling. They were on a holiday. My mom and dad were on a holiday, and my mom had an upset stomach. So she was losing fluids like nobody's business. So she went to the hospital, and the hospital guy said, just give her some glucose. And my mom's elder sister is a doctor, but she's based in the US. My mom doesn't do fucking move a needle when it comes to medicine without talking to her sister.
Right.
So spoke to her sister. She said, have you checked her sugar? Mom said, what sugar? I don't have sugar. So no, just take a check. It's 320. It was fucking 320. That's the first time my mom ever got to know that she's got diabetes. So imagine, going from not knowing that you were pre-diabetic, that means she was pre-diabetic for a fucking decade.
10 years, yeah, for sure.
Right? And then she became diabetic and she didn't know. Imagine if they would have given her glucose that day.
Yeah.
Imagine.
So they're going to hyperglycemic, and they would, and bang.
Yeah.
Whew.
So this has been my personal experience. So this topic is very close to my heart. My mom tries to control her sugar a lot now. And, it's a lifestyle disease.
Absolutely.
Right. The first thing so before I jump into the question that I have, and I have so many questions for you, honestly, because this is more like this is going to be like a training program for me. So thanks for doing it free of cost. I know you'd pay 150 quid for your course, but thanks for doing this free for me. So, yeah. So if I look at this, my personal situation now with, with my mom being not knowing she was pre-diabetic and diabetic. And the first thing she goes to the doctor, and the doctor says, you should start exercising, start lifting some weight. She also has got osteoporosis. She's in her 70s. She'll be 75 the next year. And so she's got osteoporosis. So doctor said, you need to start training, start moving, so that'll help you regulate your sugar, start walking, whatever, or going to the gym. Now, the problem is she goes to the gym, she goes in like this and she comes out right out like that, because no fucker in the gym is equipped to handle somebody who's got diabetes. Nobody wants to fucking touch the patient. They say, you know what, you need to give so now you're scaring the person. You need to sign an undertaking that we are fucking morons. We don't know anything about this. It's your own risk that you're walking into this gym. Yeah. And my mom asked the manager of the gym, does anybody here know or know anything about diabetes or working with people with diabetes? Yeah, we've worked with people in the past, but it's more anecdotal. Are you qualified? No, you're not. The problem is it's such a big market. Like India is the diabetes capital of the world, and I know
That's
the
crazy.
numbers in UK aren't very appealing as well. You're close to fucking 5 million people pre-diabetic, so it's an obscene number. How do we gear up our industry, right, and to help people get healthier? Now, one of the things I always say is exercise is medicine. And in this case, in the case of pre-diabetes and diabetes,
really is.
It really is. So, I put in a lot of questions. There's a first question, but yeah, on to you.
So you're 100% right. Exercise. We need to change the word exercise to physical activity. Okay, so we need to increase physical activity levels from standard, which is our daily chores, like what we do when we move around, to vigorous physical activity, which is when we're doing something with a little bit more elevated heart rate. So first and foremost, as an educator to educate trainers, we need to understand. We need to tell the trainers and get the trainers to disengage themselves from hardcore exercise, which is what a PT session traditionally is recognized as. If you don't crawl out of a PT session, you haven't had a good PT session. That's not what we're about.
Yeah.
Right? So when it comes to working with you hit me with 100 questions there, but so I'm going to try and work around it through them. But so first and foremost, education is the key. We need to, and this is my whole, I'll explain my journey and why Shifting Diabetes became. But the fundamental is that as somebody living with type 2 diabetes or being diagnosed with pre-diabetes, you are told by your GP you need to do physical activity, increase your levels of physical activity, and you need to change your diet habits, right? Now, the diet habits are covered because we've got dietitians in the NHS in the UK, but there are no NHS personal trainers in the UK, which is insane, right? Why we're not embedded in GP surgeries is beyond my understanding still. And that was part of my master's degree. How do we change that mindset? And it's very hard to get GPs to be able, they can't prescribe because they're not qualified to prescribe physical activity, but they can prescribe medication. So that leaves it to us. So I thought, well, hang on, I need to be able to design a program here as an educator and as somebody who's got a master's degree in diabetes. I need to spread my information or my knowledge. If we can upskill the personal training or fitness industry, and I'm saying just all personal trainers, group exercise instructors, gym instructors, anybody who works in a leisure facility, into understanding diabetes, then what we can do is we can then provide a location for those pre-diabetic or diagnosed type 2 diabetic from the GP surgery to say, oh, go to Edinburgh Leisure or go to Anytime or go to Virgin, wherever gym. Those guys are all diabetic aware. They've got a diabetic aware location, and those trainers have done a CPD and they have got an awareness of diabetes, and they'll be able to take you through an exercise program safely and efficiently so that you can train and facilitate your time slot of 45 minutes, an hour session, and actually learn about why you're doing it. Not just turn up and do it.
Phil, you are a diabetic yourself, right? And tell us, how did this all start in terms of from, relating and trying to improve your own lifestyle?
Absolutely.
And I know the story, but I just want,
So I was working for Life Fitness and Hammer Strength as a global educator, and I just happened to be in the Institute of Sport for Scotland, and I was doing a presentation over 2 days. And on the first day I was there, previously about I think it was 2 weeks beforehand, I just finished an Ironman triathlon in Sweden. And I was very proud of myself and chuffed, as you are. Still recovering, but still a bit chuffed. And I was presenting in front of these fantastic learners, the students there, and I couldn't help but notice my thirst. And I was like, flipping heck, I am really like, and I'm thinking to myself, this is all a repercussion of that triathlon.
You're thinking.
I'm thinking, why am I so? I'm obviously still can't get my hydration up. I was thirsty, and then I was going to the loo. I was thirsty. On the second day, I got to a stage where when I was presenting, I got an urge to go to the toilet, and I actually wet myself.
Wow.
because I couldn't get to the toilet in time. And I was like, oh. Now, I say I wet myself. I didn't make myself look stupid, but I did soil myself, right?
Yeah.
And I peed because I couldn't control my bladder. I was like, flipping out, right? There's something more. So I went to the doctor the next day when I got back to Edinburgh. And I spoke to him and I said, listen, I can't stop this. I'm just so thirsty. And this is what happened. And they did it there and then. They did a blood glucose test. It was through the roof. Type 2 diabetic.
Fuck.
And this is me. And do you know what the irony is? The first thing he said to me, my doctor, you need to do some more physical activity.
You fucking asshole. I just did
I just said, I'm about to get my tattoo next week. I've just done my Ironman. And he said, right, okay. So I had to work on it. Now, there are different types of direction for introductions to type 2 diabetes. You said earlier on, yeah, it is lifestyle. Generally, it's lifestyle. But there are other elements of illnesses that can affect the pancreas performance of the beta cells. And I live with an autoimmune illness called psoriatic arthritis, and I take medication for that. So my professor, who at the hospital, who I go and see annually, they were just like, well, you don't look like somebody that should have type 2 diabetes. You don't have the lifestyle indicators.
Yeah.
You train. You're not massively overweight. You're a big lad, but you're a lot of muscle on you. So the diagnosis of my diabetes is probably more so, they believe, to do with the autoimmune and the beta cell production. But still, they can't they'll not underline it and full stop and agree that that's 100% what it is, because it's still, diabetes is still, everybody's learning every day. They're learning about different forms. But that took me to then straight, as an exercise professional, that was a tutor, an assessor, advanced assessor, and I had my own active IQ. So I basically put myself on the level 4 obesity diabetes course, right? So I did the course and I went down to London to do it. So I had another organization to teach me. And I learned about obesity, but I didn't learn about diabetes because when that course was written, it was talking about obesity. The waves of diabetes, and my analogy of diabetes is like a tsunami. Under the ocean is the earthquake. And when you're on the beach, you can't see the earthquake. Right? Because the sea's flat. And that's obesity. We are so used to people getting bigger and bigger and bigger slowly that it becomes a norm. So if you look at a photograph of people on a beach in Blackpool in 1970, and you look at people on a beach in Blackpool in 2025, you're going to have a trouble in 70 to find somebody that's obese. And in 25, you're going to find somebody's healthy weight range. Totally changed, right? And that's lifestyle, that's food. So the bottom line is that obesity that happens, for 80% of people that are obese are going to become type 2 diabetic. And it's that 10-year window, as you said, for your mother and for me, possibly me, of being pre-diabetic and not even knowing about it, because it's a silent illness.
Yeah.
There's no indicators until you get a symptom.
Yeah.
And then you recognize the symptom, something's wrong, you go get checked up, blood glucose, bang. Right? And if you're very fortunate and you do go to regular screenings and get your bloods done regularly, then you will see that your blood glucose levels are climbing. Your GP will say you need to be changing. And if we can get you at pre-diabetic stage, there's 5.2 million people in the UK at the moment with pre-diabetes.
And how many of them would know that they are pre-diabetic? Or this is people who... fuck.
Until it gets to the stage where it gets too much and their blood, like your mum's up to 300 odd points, and when they do the blood glucose test, and then all of a sudden they get the symptoms, and then the doctors go, okay, now they do your fasting glucose tests, and then all of a sudden, once you've done your 2-3 glucose tests, bang, you're diagnosed with type 2 diabetes.
Phil, why is it that, I was reading somewhere before our podcast, I was doing some research on this, that it's costing NHS close to 10 billion pounds. This disease is costing 10 billion pounds. Now, isn't that a good enough reason for us to invest or for NHS to invest, or for the fitness industry. Like, we always claim, and I was talking to Espen, in my last episode, and we always position ourselves as preventive healthcare. But are we actually doing enough for it, other than saying use it as a fucking good punchline, or we are preventive healthcare, but do fuck all about it?
It's again, we've had this conversation
Yeah.
offline.
Yeah.
Right. The two of us could bang our heads against the wall
Yeah.
along, right?
Yeah.
We like to talk. Very few people like the action. Right? So that's why I created this, because I want this to action. It's a simple pathway to help 8% of our, nearly 10% of our population, to give that an opportunity as an industry to be able to help and change the actual health and lifestyle, future direction of our 10% of our population. We've got a new Prime Minister, arrived yesterday, and they're talking about billions of pounds saving on this, that, and other. Could you imagine if you took 20% of that savings of the cost to the NHS?
It's madness.
Could you imagine and put that into, let's go simple things, aged care, looking after our older population, right? The money, and what we do is we have a healthier lifestyle. People are healthier longer. Therefore, the less reduction on cost on the economy as people get. It's all about longevity. We talk about longevity. It's the key word at the moment. Everybody's talking about longevity. But the reality is, if you can control your diabetes in a safe state, even if you're pre-diabetic and change it back out of pre-diabetes or type 2 diabetes and bring it to pre-diabetes state, and you will have a longer, healthier life. You may not live very much longer, but your shortness of life may not be, but it's the quality of life and the care you need for that stage. If you lose a limb, X, Y, and Z. So it's honest to gosh, I can't get my head around how it's not a no-brainer. And I've been out in the Middle East, I've been all over the world talking about this.
You're a veteran in the industry, you spent 20 years in the industry.
I've been in the industry, yeah, exactly. But everybody goes, yeah, great, Phil, great idea, brilliant, well done, this is really cool. But nobody's like going, you know what, let's do it.
Sometimes I feel, and I think, cost of sounding like a dickhead, but I think if something doesn't make sense commercially, it doesn't work. So I'll go down to the brass tacks and ask you a couple of questions around how do you make this a commercial success. Let's understand one thing very clearly. The fitness industry is in the business of making money.
Yeah.
Right. Let's be very clear with this.
Absolutely.
Because neither is the government giving the fitness industry any benefit of doubt, saying that you guys are doing something for making the health, improving the health of a nation. They're not.
Yeah.
So the government is being a dick by saying that, we'll still charge you the 20% VAT. We'll still not give you any tax exemptions. Fair enough. You're getting people healthy, but we don't believe you. Because that's what you're saying. So commercially, unless it makes sense and I have a good enough customer base, I am not going to focus my energy towards this particular demographic. Okay. Right? Now, I'll give you an example, and then if you can add to that in terms of how we could use this as a role model for us. So I was at Rimini Wellness recently, and we had our elections for World Active, and one of our council members, Yana, runs Check Active, and they have now integrated with the actual GPs, and the GPs can recommend people to go to a gym, exercise as a prescription. So they're working around that. They're still very nascent stage, but they've got the approvals done. They've got the first sets of forms done. Now, I think the best way of doing this is if you get, like you mentioned, GPs. There are some GPs doing a phenomenal work in this space.
Yeah.
I have a friend of mine, Gaurav Gupta. He's based in London, and he does a practice which basically helps people get healthier, better, helps them lose weight, works around all these issues. And he's identified that, hold on a minute, as a doctor, I have a lot more to contribute to the society than just being a GP. Yes, I'm a GP and doing a lot for the for people who are unhealthy. Mm-hmm. But how do I get myself into that population before they get into being unhealthy, let's sort them out right here. Before they come and hit the NHS with consuming hours for for NCDs, and I think NCDs contribute to the maximum number of deaths in the world, the non-communicable diseases, and which is which is diabetes, which is lifestyle. So if I look at that as a model, what do you think? So you've been in the fitness industry long enough to say, okay, this is the problem we have as a population. This is the fitness industry. This is what we do and what we stand for today. This is the NHS, the GP. I think what we are trying to do is trying to solve things in penny packets. We need an entire ecosystem, right? So what would you recommend is the best way of going about this?
So I wrote a proposal to the investment minister for sport for Saudi Arabia, Basim, and my proposal was in two different levels. One, every single sports coach that is in Saudi Arabia has done a diabetes awareness course, therefore that becomes inclusive to all sports, right? So everybody that comes to any coach, whether you're a primary school teacher in PE, secondary school, amateur, badminton, squash, football, cricket, whatever it might be, you all have to have a diabetes awareness badge. So across society, that's it. It's a standard. But that was the second phase. First phase is primary school education. So what I propose is we do, over there, they've got 6 years in primary school. And what I was proposing, we start to learn through PE, physical activity classes, understanding the association with nutrition and physical activity. So that it's a subconscious learning. So for example, first year of school, primary school, you're what, 4 or 5 years old? Right? It's play. It's all about play. So you get things like cuddly toys of a grape, a banana, a chocolate, a cake or whatever. And you basically, teacher goes, hey, over there's a basket, 2 lines, run out and grab a good food, a bad food. Keep it as simple as that. Through physical activity and play, you're starting to already start to get the process of understanding what's good and bad, because they've got 2 buckets they've got to put it in. They go and grab something and they've got to decide, is it good or bad? And the kids have got a good, bad. And if it's bad, then they can have bits and games, plays and things like that. And as you go through your primary school education, right through to when you're in your last year of primary school, then you do a presentation on nutrition. If I do this amount of physical activity, I can burn this amount of calories, and therefore I can have this food, that food, or this food, right? And we start, so when they go into secondary school, we don't see queues of 13-year-olds buying 1 kilogram bars of Galaxy chocolate or other chocolates and a litre bottle of Lucozade for their lunch, because they already know that that's not nutritionally good and that is bad for them. Therefore, we started at the beginning, and it's going to take a process. And this is where, when I talk about my tsunami and my earthquake and diabetes, that's the earthquake. We're stopping the earthquake at source, educating, and then the waves coming on the shore, which is diabetes, which right now is just continually smashing the shores.
I mean, I don't even know how schools allow, and honestly, this is something that really pisses me off. Fast food, I have always said this, and it's very controversial. Fast food is more dangerous than cigarettes, and I'll tell you why. And alcohol, because when you go and buy a fag, or you buy a bottle of alcohol, you are checked for ID and you're making a decision which is an informed decision. So the cigarette pack says, this could happen to you, got all the pictures. I still decided I want to fuck myself and I will buy this. It's fine. But a kid who's 6 years old, 5 years old, just doesn't know fucking shit about shit. So he's now addicted to
sugar,
Mackey's nuggets, Galaxy bars, Prime as a drink, and Lucozade, and guess what? They're the cheapest available. So A, it is cheap. B, it's accessible. C, nobody's looking.
Nobody's
Are you fucking joking?
And parents can only do so much because the kids are in their eye all the time, right?
Yeah, you can't do anything about it.
Then there's peer pressure from the colleagues, from the kids' friends. So 100%. And Jamie Oliver, I'm a real fan of Jamie Oliver. He tried his very best to change the school diet.
He did.
But the parents went against him because the parents' education. So there's 2 different forms of literacy we need to think about here. We need to think about Physical activity literacy. Why? Why do we need to do these exercises? Yeah, we know. You and I both go to the gym, right? And you walk in the gym and you go, I really don't want to do this. But when you leave, you go, nobody leaves the gym going, I wish I hadn't done that. They all go, that was great. I'm glad I've done it, right? But going in, so we've got that barrier, but that's so we need to understand the why we're doing it. That's physical activity literacy, but we need to understand nutrition literacy. And this is where nutrition literacy, if we can marry that up with primary school physical activity and make it a play thing, so they understand, right? If you're going to do and play basketball for 10 minutes and you have this amount of calories, how many calories are you going to burn off, right? Boom. Why would that be an advantage, right? Boom. And make it a point. Make that a point rather than a basket.
Yeah.
So it's all about introduction. So this is this whole thing with Saudi Arabia, because in Saudi Arabia, they've got 23.4% of their population are type 2 diabetic. 23, that's nearly a quarter of the population are living with diabetes. And it will continue until things change at primary school source.
I sometimes feel, our industry is failing this population. We're not done enough with our personal trainers, and I don't blame personal trainers for it, because at the end of the day, in the developed world, personal trainers are self-employed.
Yeah.
They manage their own business, so they are supposed to be their own business. And if they are, and if we as an industry don't spend money in it, it's just a never-ending cycle. So I feel, and I don't want to sound like a pessimist, because I'm not one. I think there is a solution. There is a light at the end of the tunnel. I see that. Like the work you've done, I really liked, when we first spoke about it, I didn't even know that someone like you existed who did, I knew of you, but I didn't know what you did. I just knew as passing that you do something around diabetes, that's about it, but nothing more than that. And then later I got to know that you actually created a CPD, which is, approved by SIMSPA, which trainers can take on. So it's like, you've just given them the arms and ammunition to go and fight this war.
This is the crazy thing, right? But we've talked about this before, right? You got the tools, but they don't understand. The personal trainers don't understand the potential market.
I think the smart ones do.
Well, maybe the smart ones do, because we've sold a few courses. We have sold a few courses.
Yeah.
But there's also a lot of trainers there that can't get their head round that this market's there. There's nearly 10% of our population are living with pre-diabetes or diabetes. Right?
Okay, so tell me, let me take a step back. Now I'm a personal trainer. Like, assume I am, it's called a CPD on diabetes for dummies, right? I don't understand, right? I'm young. I've just passed out my course. I'm 24 years old. I've gone to my gym. I've got the first job. I'm paying rent for this. You want me to pay some money to get a CPD done? How's it going to help me build my business? So now, say you're educating me not only on diabetes, so that's one bit of it.
Yeah.
The second bit is on building the business, because you're a 20-year-old vet. You've been in this industry 20 years, so you're a veteran, and you know exactly how the industry works. So I'm a 24-year-old coming to you, taking my first job. I want to make a difference.
You want to be different?
I want to be different.
So
I want to make more money.
So I'm going to tell you how to be different, right? So that's why I've put at the end of the course, you get a badge. That you can use in all of your marketing material that says you're a diabetic aware trainer, right? You put that logo onto every single piece of your marketing material, and you market towards the diabetic population, right? And all of a sudden, people start coming to inquire because they're diabetic. They've been told by the GP, you need to do physical activity. And you know what? All of a sudden, there's a diabetic aware trainer. That guy understands diabetes, that person. So therefore, you become your own marketing hub by having this badge. Now, then I thought to myself, well, that's pretty cool. So that my trainers that have qualified, they get their badge. But if we get everybody in that gym group, small private gym, large corporate gyms, council-led gyms, if we get everybody, all the trainers, all the gym instructors, front of house staff, the group exercise, swim coaches, everybody. If everybody gets the diabetic aware badge for their individual ability, then we give the location a diabetic aware location badge. So now all of a sudden your gym becomes a diabetic aware. So then you go.
I didn't even know this.
So then you go as a business to all the GPs within a 5-mile radius, and you go and say, listen, we have upskilled all of our trainers.
This is a fucking business model right here.
Of course, it's a business model. This is what the whole thing is. But people don't want to. People haven't asked the question. And it's so terribly difficult to get this passed because the first point of contact is PTs, right?
So hold on a minute. Hold on a minute. Just yeah. I mean, let me get this straight. So you're telling me a gym, a leisure center site can actually get this by if they get all the trainers to be certified, or if I make it mandatory. For example, I'm a site ABC in a location. Say I'm in Manchester and I've got a gym,
Yeah.
and I've got 25 PTs who work for me,
Yeah.
self-employed. They come here and I say the criteria of being self-employed here in this facility is that you need to take up this course. I'm happy for me to fund it for you, but you'll pay it to me over a period of time. But as a facility, the only way you will enter this facility is if you've got this.
And then all of a sudden, you become a mecca for people who live with diabetes.
So why the fuck are people not doing it? Like, I mean, what's the resistance? Do you have any sites who are already doing it at the moment?
No. It's insane. It's insane. And do you know, I've spoken to local authorities, I'm not going to name them. Well, I am working with one local authority at the moment. They're very proactive and we've done a really good case study. And the case study from the questionnaires from their workforce has unanimously come back saying they want to be upskilled in diabetes so they can help the diabetic population in their county. Okay, so that's in England. The problem we've got is that all local authorities, which is if we talk about local authorities, they're all under budget, right? So they're all minimal costs. But what they don't see, and what they can't get their head around, is that if you do that, you're going to have that 10% population that does, and I'm going to be probably brutal here, I would say probably 90% of that population don't go near a gym.
Yeah.
All of a sudden, you have a location for that community. You can build classes, small group exercise classes for diabetics. You can do personal training for people living with diabetes. You can do all sorts of education for people living with diabetes so they understand the why. And then all of a sudden, guess what? Your gym membership goes up. Your gym membership goes up, you get more money coming in, therefore it pays for itself. It's honestly, it's like a vicious circle that is not being explored because the first barrier is cost. Now, there are many ways to work on the cost of developing education. I'm very fortunate, and I'm going to say this, and this is probably not the right business model to say this. I own the intellectual property. This is a registered company. I own it. I am a sole owner, individual, Shifting Diabetes. If you as a location want to come to speak to me, if you tell me how many trainers you've got, I have the ability to adjust the price to make it work. Right? Because at the end of the day, I'm somebody that lives with diabetes. I want to help the diabetic population move more safely and effectively.
No, so Phil, I don't usually do this, but I'm on the podcast on camera. I'm going to commit to you one site in India, which is my own site. I'll do this for my own site. I have a few sites in India. I'll do it in one site.
Let's do
That's
it.
my commitment to you.
Well, we're doing it.
I'm shaking hand on that. There we go.
I'll do
Yeah,
it.
they never do this on
Absolutely.
camera, but yeah, I'm going to do this.
Let's do it.
100%. I'm. This is very close to my heart because I know, my mom struggles with going to the gym for the same reason because, and I do, and I'll tell you why. Honestly, I don't want to go to the gym where people are not equipped to handle or understand her condition. And I'm sure a lot of people have the same problem where they're scared. Yeah.
So one of the greatest things, my great learnings when I was working with Life Fitness and Hammer Strength was the journey. And I'm going to name drop here. It was Mr. Manel, Nick Manel, who you'll know Nick, and also Keith Smith. And it's all about the fitness journey. I said about when you walk into that gym, you then want to go through the journey of the gym so that it's accessible. So you don't want to see the half racks and the strength and conditioning is right in front of you as you walk through the door because it scares the hell out of you and you'll walk straight out the door, right? You want to see the soft stuff. You want to see the stretching mats. You want to see the resistance bands. You want to see the fixed pin loaded machines. Yeah. Then you want to go around the journey to your CV. You have it. That's the journey. So we have to create this journey with the diabetes, and it's all about that initial first call. So have the guys in your sales team, do they understand it? So they should have it upskilled as well, and that should be one of your questions because Like all gyms, they ask you to fill a PAR-Q form in. Are you physically ready for?
Yeah. We do that.
And then we ask the question: oh, have you diabetes, pre-diabetes, or whatever? Yes, we have. There, all of a sudden, there's your sales engine. The salesperson then says, "Listen, all of our trainers are diabetes aware, and therefore you have you're in safe hands. Any of your trainers, just ask us, and we'll help you out." All of a sudden, that barrier is taken away from you, right? You don't have to climb over a mountain. You don't have to hide behind a rock because you're terrified. You go in there and somebody greets you and they say, "Hey, welcome. Right, I believe you've got pre-diabetes, whatever it is. You've indicated are your illnesses, and then for you go for it." Because we do the screening. Like if you've had any heart conditions, right, the first thing you do is ask heart conditions. It's like and then you have to assess: has somebody done cardiac rehab? Have they done exercise referral? I'll let you into this one as well. We're about to launch a level 3 diabetes
Are you?
qualification, a full qualification. I'm just waiting for that to go through. So once that goes through, then we're going to be, and that means then the trainers will be actually a diploma in diabetes for exercise.
Phil, one of the things that you mentioned, like we do a PAR-Q and we try to do this. So explain, if I am not aware of diabetes or, what it does to
Yes.
somebody, I'm a personal trainer, what could go wrong in a session with a customer, with a
So
client?
this is a really good question. So if somebody doesn't know they've got pre-diabetes because they haven't been to the GP for they're scared or whatever reason, if we as a trainer, part of the course is an awareness of diabetes. Therefore, you can look for symptoms, right? So you can talk to your client. How are you getting on? How are you doing this? How's your water intake? Do you ever get thirsty? Do you ever get blurred vision? Do you ever get sleepy after you've eaten food? Little key questions that you get because you've done the course, you got the awareness, that you can then start to build a picture up with your client as you build that relationship. That allows you then to say, do you know what? When's the last time you went to the doctors and got a blood test? Do you get any blood tests? No, I haven't been there for it. Listen, get yourself and go and do a blood test.
Yeah, people are getting pre-diabetic in 20s. It's fucking crazy.
So today in the news, and I was driving down, I think maybe 5 a.m. this morning, I was listening to the news. Right today, a paper's come out to indicate that since COVID, the population from 20 to 30 now is one of the highest growth in type 2 diabetes.
Fuck.
Obesity. It's obesity, obesity, obesity.
Madness.
Right? It's crazy. It's insane. And what's really interesting, and I need to explore more, obviously I was driving, I haven't read the report, but what I want to explore, over 65s is decreasing.
Because they're aware.
Because they are educationally aware.
Yeah.
They're more mature. They probably have more time to do physical activity. Yeah. And they more than likely over that age group, they've got more financial ability to be in gyms and move more. Because we know that that's where the population of the majority of gym goers are in that age group.
Phil, you're currently pursuing your PhD from the Queen Margaret University, if I'm not wrong.
Yeah.
And that's around a 12-week program. I mean, I just know that you're doing we spoke about it briefly.
I'm participating in a PhD, which is, I was told it would be difficult. It was very, very difficult. And it's not because it's difficult to do. It's difficult because of the time it takes to do it.
Yeah.
And then the research and go through. It took 15 months to get my NHS ethics to be able to conduct my trial. 15 months. It's insane, right? But that's part of the gig, right? So you got to roll with the punches. What you're talking about, the 12 weeks. So 12 weeks and beyond is a different course that I've created. Now, how do I start this? So 2 years ago, I did a beta test on 14 people living with diabetes. And I took them through a year of support. And it was called 12 months and beyond. Okay. I worked in a clinical team. I got a doctor, a GP involved. I got a dietitian, state registered dietitian as part of my team. And I got a mindset coach as part of my team. And what I did was we worked on 4 blocks. So we started off in blast off, which is the first 3 months, and that's to try and lose as much weight as possible, working with the GP. So every week I would be on, and then the following week I'd be on with the GP, the following week I'd be myself, the following week I'd be with a dietitian, and we go through this. The guys would have the exercise programs, they'd follow the program, they'd learn from our podcast, our what do you call these things? Whatever, presentations, LinkedIn, not LinkedIn. What's the other one? Whenever you go on screen, it's not LinkedIn.
YouTube or
No. Whenever you, social media thing, when you get everybody to come in and watch you.
Oh, live.
Yeah, live stream. Yeah. Live stream. That's the word. That's the word. So we did live stream, and we do an hour every Wednesday night, and they would come and they would have a chance to ask questions to the doctor, and they'd ask questions to me, and I would point some questions to the doctor that had been pre-asked. And then the same with the dietitian. And then I would do another, then they would get given a presentation by me, a PowerPoint presentation, which would last about half an hour to give them more education. And then they go off, do their exercise, and do check-ins with me and do their programming. Every single one of those patients dropped from, one lady in particular lost 4 stone in weight. She was a diabetic living on insulin. Came off
stones, close to 24 kgs, more than 24 kgs. Wow.
Yeah. And do you know what age she was? 75.
Wow.
Can you change? Yes, you can. And does she reduce? So she reduced her insulin down to the minimum dose. And she just takes a little bit of insulin now because she's insulin dependent. Whereas beforehand, she was just constantly jabbing away because she didn't understand. Food labeling. Go and look into a label. Who reads the label on a package and goes, I'm going to put that back because it's not good? Who does it? You tell me.
I think honestly,
When's the last time you did that?
I mean, obviously, I mean, I one thing I found amazing was, the first time I came to the UK was about 10 years back. And I was talking to somebody and he says, and I said, I'll have a Diet Coke. And he says, yeah, I'll have a full fat Coke. I said, what's a fucking full fat Coke? Coke's got no fat. That's how bad people's understanding of anything that's got fat is bad. But they don't understand fat's not a problem.
Fat's not a problem.
Yeah. And I just think the awareness of nutrition is only getting worse with time.
Yeah.
And the problem is the accessibility to processed food. So the cheaper, and I was sitting in, and I'll tell you, this was beyond active in Bangkok. I was sitting, as an audience, and Paul Ferris was speaking. I don't know if you know Paul.
The name.
Yeah. So Paul was the youngest player to play for Newcastle United. He was the physio for Newcastle, and then he went on to be the CEO and founder of Speedflex. And he was speaking on the panel, and he says he's an amazing storyteller. He's a best-selling author as well. So he's written multiple best-selling books, the sports autobiography. I mean, can go on about him. So anyways, so Paul's here speaking, and he's got a knack to tell stories. So he said this, and I could visualize it. He said, guys, you need to understand that, there's a family, parents, 2 children sitting, watching TV, having pizzas and Cokes and nuggets, and they're having a moment as a family because that's what they can afford. And you walk in there as a dickhead and say, guys, you're fucking killing yourself. You can't do that. No. You can't do that. But the reason is because that's what they can afford. They can afford the 2-pound pizza and the cheap drinks that they're getting. The problem is good food is costing a lot. And processed food is cheap because I won't even call it,
it's not really
food.
Is it?
Yeah, exactly. It's not really food. I mean, the UK is still better. The US is, fuck me, man. You can't.
Horrific.
Yeah.
There's sugar and whipped butter.
It's just
corn syrup.
Insane. I've been wanting to ask you this question. You see, it's very controversial, but I think the GPs or the entire medical fraternity has classed diabetes as a lifestyle disease, and a chronic condition. So what they're doing is they're taking away personal accountability from the person's hands, and most diabetics feel I can do nothing about this. Mm-hmm. I'm just the only solution I have, and I'm telling you, my mom, she says I control my everything, but I can't do anything about it, right? And I keep telling her, yes, you can. There are things you can definitely do.
Yeah.
But the thing is, because let's be very honest here. The credibility of doctors versus personal trainers, there's no comparison. Like the doctors are right up there in terms of in the eyes of people, and rightly so. They've studied so much. Our people are not even willing to spend a couple of £100 on and getting a course done. So obviously there's this gap. So when a doctor says it's a lifestyle disease, it's a chronic condition, you just taking away personal accountability from people. It's very controversial. I think people need to take accountability of their own health also, and not rely on.
Yeah. Yes.
I mean, in terms of if you are, I'm not saying, and I'm absolutely, this is coming as a complete layman. I'm not talking as an expert because I'm not one, and I don't want to claim to be one. But I'm saying, in my mind, I'm trying to get my head around this thing. Okay, one, I've got this condition because of my lifestyle, which I fucking chose.
Yeah.
Right? And I've got here. Some cases, it may not be only lifestyle, it could be some other condition, whatever. But can I, as a person, get myself out of the equation by not taking personal accountability for my health? Can I do something about it?
Let's go back. Your lifestyle necessarily isn't chosen by you. It's chosen by your parents.
Correct.
Right? So you're conditioned. Behavioral change, as we understand behavioral change, starts at the home.
Mm-hmm.
Right? So if your mother and father are physically active and that's part of their lifestyle, and they eat vegetables and they eat lean meats and they're fit and healthy, guess what? You're probably going to be similar to that as you grow up because you use them as role model and that's your lifestyle. But unfortunately, the large percentage of the population now in the UK is not that person. Okay, we're overweight. We're picking up processed food for convenience and cost, right? And therefore, our children are getting behavioral change, and the psychology of behavioral change is being developed in childhood. Therefore, when they become adults, young adults, they don't know the difference. They don't know how to peel a potato, how to chop it up into chips, how to chop it into cubes, how to make it into waffles, right? They don't know how to do that, how to mash it, right? They buy chips out of a freezer and they stick it in the oven if they're a slightly healthier option, or they go to the chip shop and buy it because it's cheap, right? Or they go and buy a burger, right? Now, you and I know that if you have a piece of like a chicken breast, right, it's got X amount of protein in it. It's probably going to have some water in it there as well because they infuse it with water to bulk it out. But the reality is you've got a marker there where you can say it's protein. There's 4 grams of 4 calories per gram of protein. So therefore we can work 100 gram chicken breast is going to give you 400 calories of protein, right? We can work that out because we're educated.
Yeah.
But they need these children to understand macronutrients, fat, carbs, proteins, alcohol. If you're taking these things on board, what is their value? What is the value? Right?
So tell me, what does alcohol do?
7, nothing. It's poison.
Yeah.
It's just poison.
So when I consume a glass of alcohol, right? So
you've got to be careful here because there's going to be lots of people listening to this going, "That drink." You're like to get fucking abused. Yeah, we're going to get abused. Listen. I played rugby at a high level. I have enjoyed beer, right?
No, fair enough.
At time and place, but in excess quantities, it's not very good. It's not good for us. But if you're in a nice balanced diet, okay,
but
it's
still,
absolutely fine. However,
still tell me, I've had a glass of alcohol. What's happening in my body now?
Well, your body's having to fight to process it because you're putting in something your body doesn't. So you will be started to burn up the calories to burn that. But it's the effect of consistent alcohol induction into your liver is going to cause you the problem. And if we have a liver that's not working, that's one of your fatty liver or cirrhosis through fat or cirrhosis through alcohol, it's going to have the same effect on our pancreas and it's going to cause you issues with your diabetes. But that's in quantity. Alcohol itself, you know yourself. I mean, I'm not a specialist in alcohol, but there are flavonoids in red wine, which are good for us. And a glass of red wine that is indicated that's actually quite a healthy thing to have. It's not a whole bottle of red wine, right? But then that's the problem, right? Because it comes in a bottle and there's 6 glasses in a bottle. You can have a glass every night, and it's reasonably healthy if the rest of your diet is there. What my concern is the volume of calories intake versus calorie expenditure. And that's the difference between gaining body fat and not gaining body fat. Then you've environmental issues, and we know that there's the internal fat is called visceral fat, and that's a stress fat. Right now, that can happen because you're living in a household that's full of stress. Or it could be your job's full of stress, or you get constantly chased by a dinosaur on a daily basis, and that's full of stress. Your body doesn't understand stress, so your body goes stress. You get your cortisol increases.
Yeah.
Your cortisol increases. Your insulin response increases because cortisol increases, right? And your body goes, "Oh, hang on, stop producing. Let's use the muscle that we've got in our body as our energy source, and let's store everything as fat because we don't know when we're going to need to be out of this stress." It's just a vicious circle.
Your new CPDs are also around the, trying to work with the weight loss drugs that have been in the market now, without naming any one particular drug.
Yeah.
And it's also supposed to solve this problem in a way if it is handled the right way. Can you explain this, in more detail?
Yes, because I've had first-hand experience with a GLP-1 medication, semaglutide, because of my diabetes. And it's an appetite. It slows down the digestive in your stomach. Reduces the noise, the food noise. So you're not looking for food. You don't feel as hungry. That falls into two categories. So that can work for you if you understand it. You still have to have a balanced diet, and you need to have your proteins, carbs, and fats in your diet. But if you don't feel hungry because of the medication, and you decide just to eat a carrot and have one form of macronutrient and reduce your proteins down, then what's going to happen is you're going to lose weight. But when you lose weight, you don't just lose fat; you also lose lean mass, right? And that lean mass can be your muscle mass, right? If you're losing muscle mass, we know, you and I know as trainers, that means your metabolism will decrease. If your metabolism decreases, your thermogenic burn decreases. Therefore, you're not going to need as many calories, right? But if we stop taking the medication because we've hit our goal of weight loss, guess what? You've lost fat, but you've lost muscle. Your metabolism is down. If you start eating normally again, and your metabolism is on its arse, whereas it used to be slightly higher, then what's going to happen is you're just going to store fat, and you're going to get fatter. And I'm pretty sure I read a 6.5 times faster increase in body fat after GLP-1 if you don't have a behavioral change program. And this is why it's so important. I've got another GLP-1 course to understand the best practices for working with population taking GLP. And it's not just for people living with diabetes, right? We need to have a behavioral change program alongside. And if I'm going to put my pound into the corner here. If you're prescribed GLP-1 by a doctor, physician, and NHS doctor, you should be prescribed physical activity training with it.
Are we?
You should be.
But are we doing it now?
No, we're not. But we should be.
And why not?
Well, because we're not. Because the NHS don't recognise us.
And so, what do you think we should be doing about it?
So what we need to do is we need the NHS to recognise exercise professionals and get our exercise professionals upskilled in understanding how GLP-1 works with the population, so that they can design a program so that you're doing at least 2 lifting sessions a week and you're doing at least 3 cardiovascular sessions a week, and that becomes a behavioural change over the course of while you're taking medication. So when you reduce your medication, you can continue your exercise because you've changed the behaviour and your lifestyle has changed, and then all of a sudden you're able to maintain and control your weight loss. If you don't, you just bounce back up again.
Like, I understand what you're saying about NHS not recognizing us, but there are things being done by the industry. Like, you yourself are doing that 12 weeks and beyond program, and something like that could be very well integrated with, with medical practitioners. So, what's the 12-week program? I've heard a lot about it.
So we previously talked about the 12 months and beyond program. So I used that as a case study, and I basically reduced that down to a 12-week program. So I'm working with an app developer at the moment to create an app that can be used, and where it lands, I'm not 100% sure just yet, whether it's with the trainer or whether it's with the doctors, GP doctors. basically you can put in your information into this application, and it will spit out a nutritional program for 12 weeks, exercise program for 12 weeks, which is progressive, which will help you as somebody that's newly diagnosed with pre-diabetes or type 2 diabetes, and depending on your medication format, to be able to actually have a program there and then. Now we can use that as a personal trainer, and my initial audience is that when you do your when you complete your diabetes awareness course, then I will give you access to this application, so that then you can use that application. So whenever somebody living with diabetes comes to your gym and goes, do you know what? I need a program here. You can then actually put in a bespoke program that works bespoke for that person. Not a generic program, bespoke to them, right? And then you as the trainer can take them through the exercise. So that's your job, that's your thing. You can take through the exercise format, but you've also got then nutrition. You've got cookbooks. I've created several cookbooks. So those books with recipes, methods, nutritional breakdown, they're all there. Right, so we've got all of that information on board. It's a simple process. It takes, as you know, creating an application takes a bit of time and funding, but I'm getting there. So my goal is to have it ready for the end of this year, so it's ready to launch. And I think that India, your marketplace, is where we hit it first, because it's a really simple process.
Yeah, and we are the diabetes capital of the world. So yeah,
The numbers are there, right?
What better place to start? My last question for you, Phil, it's more like it's more for me than anybody else. And this is something a lot of people ask me, and I want to ask the expert. People say if you have a lot of sugar as a kid, you will end up having diabetes, or sugar is the culprit. Is that the actual thing? Is that one of the things?
Okay, cool. So sugar increases your glucose index pretty instantly when it's ingested. So you will get a spike. You will then get a crash from a spike. So what we're trying to do is, when it comes to sugar, you want to have refined sugar, complex sugars. So the likes of oats, things that are slowly digested rather than high refined stuff.
So you don't want the glycemic index.
Yeah, so we're talking about glycemic index. So as a kid that eats sweets, kids eat sweets, right? Yeah. That's what Standard. They do. And unfortunately, our grandparents are the worst, because they treat them and they say, oh, let's have a wee this, that, and other, because they see them occasionally, right? And that becomes associations. Granddad gives me sweets, a cake or whatever. And you get the dopamine rush from feeling great because of the spike. And then you get the wee crash and you go home, the kid goes back to the parents grouchy and grumpy because their blood glucose has crashed. So trying to introduce a healthy diet to children is the key, right? Is it the reason you get diabetes? Diabetes is obesity. 80% of people, as I reiterate, 80% of obesity is diabetes. Sugar will increase your intake because it's almost like, I call it a cheap food.
Yeah.
Therefore, you can eat a lot of sugar, and it's in everything, and ingest a lot of sugar and a lot of calories in one go. So you think about a Mars bar, and there are other products out there, obviously, but you look at a Mars bar, that is full of sugar, right?
Even a slice of bread is sugar, technically.
Yeah, absolutely. White bread. But if you have a wholemeal sourdough bread, there's less sugar in it, right? So therefore you're going to get less. So it's all about education of that. And if we can reduce the sugar intake, that will help to reduce the calorie intake. And if we can reduce the calorie intake and balance calorie intake with a calorie expenditure, that's the difference between having a healthy state and being in a healthy body standard rather than being in a deficit or an over expenditure, right? So we want to try and reduce obesity, right? Because if we can help reduce obesity through nutritional literacy and physical activity literacy, then obesity falls and we end up having less diabetes. It's a simple equation.
Brilliant. Thank you so much, Phil. Appreciate your time today.
You're very welcome. It's been brilliant. Thank you.
Great.